Hello and welcome to ACTV 20's Health Matters. I'm Dr. Eric Parks, and today I have the pleasure of introducing you to somebody who's going to talk about a topic that is really exciting, and it's a very special topic for me too. I'd like to introduce Heather Perry. She's a local chiropractor in town, and it's good to hear your voice and see your smiling face.
Yeah, thank you for the opportunity to talk about this.
Well, today we're going to talk about a subject that has to do with craniosacral therapy. And this is a type of therapy that most people are probably not familiar with, but has a profound effect on our health and how we function. So we're going to talk a little bit about first what craniosacral therapy is, and then we'll tell you a little bit more about the types of treatments and what they're used for.
Okay.
So I'll let you take it away as far as tell us a little bit more about where craniosacral therapy started and what is it?
Okay, well, craniosacral therapy is a gentle, hands-on treatment to remove restrictions within the soft tissues around the central nervous system. And what this basically means is that the practitioner or therapist will use their hands like a chiropractor or a massage therapist would to identify any problems, restrictions within the membranes around the brain and spinal cord or in the sutures of the skull, find them, release them, and what that does basically relieve pain, tension, and helps the whole body health.
Wow. So from what I understand, there is an actual movement that takes place in this cranium of ours, this skull bone. And the skull bone, as we all know, is not made up of one bone, but 23, is it, individual bones?
Yes.
Now, what happens? I mean, what's going on with that structure? Is there movement?
Well,
is there supposed to be movement?
There is, and this has been a discussion and sort of at odds in the medical community for a long time.
Mm-hmm.
Craniosacral therapy was developed most recently by Dr. John Upledger, but he based his work on Dr. William Sutherland. Dr. Sutherland was an osteopath in the early 1900s. Now, he acknowledges his research started with Dr. Still, who was also an osteopath in the 1900s. We call him the father of osteopathy. We call Dr. Sutherland the father of cranial osteopathy because Dr. Sutherland was the one that took the interest in the cranium farther and started doing his own research. The sutures are sort of interdigitations, kind of like this, if you will. And he theorized that they were designed not to have no movement, as we thought after adulthood that they would be fused, but to have some movement. So Dr. Sutherland went around and started doing some research on himself. As I understand it, he made a skull cap, and he put different areas to screw in, and he would screw in an area, tighten down one of the areas of his skull, and walk around like that for a day. And then he would write down what happened, what symptoms he was having, and then he would do it again and again. I'm sort of amazed that he wouldn't have some long-term issues from this. But so he did research and did his own work for about 20 years. Mm-hmm. And he came up with a system. He came up with some understandings about what is happening with the cranium, not so much the whole cranial sacral system, but in the cranium. And he did teach cranial osteopathy. That's definitely been at odds in the medical community, was for many years. But I think now we finally understand, no, the skull bones are not fused.
Right, which actually is interesting to me because many physicians that I speak to, they still believe that the skull is fused at these suture points. But I think if that were the case, just like an egg, if you hit your head, it would crack like an egg. But because the sutures are there, it allows some flexibility so that the skull will not always crack when you hit your head.
Yeah.
So there's fluid in the brain called cerebrospinal fluid.
Yes.
And could you tell us a little bit more about what happens with that cerebrospinal fluid? I mean, how does it get from the brain through the spinal cord and all that? Do you know?
That's a long discussion, and I will say initially that I think that is not as well understood as it could be lately. I think we still have some theories on that. Mm-hmm. Dr. John Upledger is the one that did a lot of research with that.
Right.
And he has some very good mechanisms and ideas about what happens with there. Let me back up a minute and go back to where he started. He took up, he was at Michigan State University in the 70s and was assisting a surgery, and the head surgeon asked him to just hold the membranes of, he was doing a neck surgery, hold the membranes still so that he could do
Of the spinal cord? Or they had
of the
that?
spinal cord.
Oh,
Yeah,
my.
hold the open it up, hold them still so that he could work inside in this very delicate area. And Dr. Upledger found, to his horror, that he could not hold them still. And it was a long surgery, so he had time to realize, okay, it's not my heartbeat, it's not my breathing, it's not the patient's heartbeat or breathing, it's an independent rhythm that he was seeing. And this is not something that he had seen before, he knew about, that he'd learned about. So after the surgery, he looked in medical tests. He asked his colleagues, what do we know about the rhythm of, cranial sacral rhythm? There wasn't any knowledge of it.
Mm-hmm.
So from 1975 to 1983, he actually was a professor of research at Michigan State University and had anatomists and biophysicists and bioengineers and was able to do a lot of research to understand what's going on. And what they found, they were able to prove that, yes, the sutures are not fused, that they do have some movement, and that there is a cranial sacral system. One of the interesting things that they found was that there are nerves that go right into the sutures.
Right.
And again, with that, why would you have a nerve within
Why,
the
indeed.
suture if you didn't have to measure pressure, movement, tension, things like that? So the theory on how the fluid works.
Now pay attention for you
Yeah.
at home. This is not a real skull. It's a plastic
Plastic
skull.
skull.
It's really nicely colored so you can
It
see
is.
the structures.
So one of the things I want to point out here is there's a membrane around the brain and the spinal cord, but there's also an internal membrane, and that's what this is. So we'll take that out. But
That's how football players can get hit in the head and not be unconscious, because that membrane helps to really hold the brain.
the membrane has the fluid within it that cushions the brain.
Right.
So you have a little bit of a cushion. You can still get a concussion, which is a big bruise on the brain
Right.
when it slams into the skull, because you have fluid, but it's not totally protected. But we need all these things to protect the brain. So what's not fully understood is how and where cerebral spinal fluid is produced. We used to think it was produced in something called the choroid plexus in the fourth ventricle, but we now know that's not entirely true. It's being produced all over, filtering through the blood-brain barrier. So you have an influx of fluid coming into the brain, and then you have a constant draining off. So what happens is when you have the influx, you've got some widening, very little, widening of the skull, where it's just a little bit of pressure.
That's
Sure.
opening those up, yeah.
And then you have the draining off. And this is what they call the cranial sacral rhythm. That's what Dr. Sutherland was feeling. He called it the primary respiration. It's what he was feeling, and you can feel it. You can feel it on the head, but you can also feel it anywhere else in the body, and that's because the membranes around the brain and spinal cord protect it, go through to the peripheral nerves, which these are the peripheral nerves coming out here. So they would have...
So from the spinal cord, those pass through those little holes between the bones.
Yeah, and they would have the
body.
membrane, and then the fascia has to meet these to protect them. And then that is continuous with the rest of the body, because we have fascia surrounding all the nerves, all the muscles, all the organs of your body. So how you feel the cranial sacral rhythm throughout the body is not only through the membrane, but throughout the fascia that is continuous. And that's where we can...
So there's a whole body movement that's really accompanying this cranial rhythm that can be felt by people who are trained.
Yes.
So that, and that's really interesting, because they've, as you were explaining, they went from discovering that there's the ability to move in the skull, and that the fluid is actually possibly pumped with these movements from the brain to the end of the spinal cord and back.
Mm-hmm.
And then that those tissues that are holding that fluid in also connect with tissues that also are felt throughout the whole body. So this craniosacral rhythm is actually more than just the head and the end of the spinal cord. It's really the whole body.
It can be felt throughout the whole body.
Wow.
Definitely, which makes it interesting for people when they wonder, why are they working on my leg when I have a problem in my head? But it is all connected through the fascia.
That's fascinating. So go ahead with the story if there's more about where Dr. Upledger went with his work.
Well, that's the majority of the story. He has, well, the other big part of it, I suppose, is he's developed an institute called the Upledger Institute.
Right.
This is where people can get trained in craniosacral therapy. It's different than cranial manipulation done by osteopaths.
Right.
Cranial sacral therapists you don't have to be a medical doctor. They typically train physical therapists, massage therapists, chiropractors, nurses, sometimes people who have disabled children and have found that cranial sacral therapy has helped their children will learn to do some on their children. So it's a very gentle, light touch therapy, so a lot of different people can learn that and use it.
We'll get into that a little bit more. I want to obviously discuss what sort of things can be helped with that. But I'm interested in how you yourself got involved with craniosacral therapy.
Pain is the short answer.
Pain.
Yeah.
Drives so many of us.
Yeah, and I guess the story is I had a car accident at 17, pretty bad whiplash, and yeah, I was in high school, finishing up high school. My mom had taken me to chiropractors before the accident, and so after the accident, she did take me to some chiropractors, and I had some visits here and there, but it really wasn't enough to correct the problems that I got from the accident. And then I went off to college. And in college, I did not have the funds and the means to go and get a lot of treatment, but I did go and see chiropractors here and there because I was in a lot of pain. I had debilitating headaches all the time, and just kind of dealt with it like a lot of people do, because you figure, well, it's the way it is. But I knew chiropractic helped, and it was sort of amazing to me. So I ended up going to chiropractic school and becoming a chiropractor. And it was after chiropractic school that I was looking around the West for a place to settle and ran into a chiropractor in Flagstaff, Arizona named Dr. Herb Roscoe. And he did an interesting type of chiropractic, and I decided to move out there and do an apprenticeship with him. And so I worked with him for about 3 months, and I would observe him, he would teach me, and he also worked on me. And he started working on my head, and he started working up inside my mouth on these bones up here called the sphenoid. And I noticed that when he would work on me, my headache would go away the day of the treatment. And previously, before with chiropractic, people would adjust me, and the headache would go away a day or two later. It would stay away for a while and come back.
Right.
And after about a couple months of him working on me, doing chiropractic and doing craniosacral therapy, I started to notice that my headaches were not as debilitating. They were going away, and they were not coming back. And I realized I'm missing something here. There's something more I got to learn. I learned what I could from him, but his point was, this is delicate work. You have to learn the whole system. I'm not going to just teach you a couple moves. So if you want to go further into craniosacral therapy, go ahead and do that. I found Dr. Upledger's book on his shelves and found that they had the institute, that they had a program. And so then I started taking the seminars and took seminars for probably about 4 or 5 years or so.
Yeah, there's many levels, I understand, and most of the people who are lay people want to take the first couple.
Yeah.
But if you were going to do it professionally, you would want to learn the whole.
Yeah, there are many levels. You can get a certification. There's advanced. We have a woman here in town named Melinda Ney, who's an instructor. She's amazing. She's been doing craniosacral therapy for years. And so you can take it to a really high level through them, or you can do just 1 or 2 courses. They also just have introductory courses, which Melinda teaches. And this is the kind of thing that a lot of parents will take. They'll take the introductory course so that they can do a little bit of work on their child in between, more significant sessions.
I have personally taken the introductory course.
Oh, I didn't know that.
Oh yeah, that was many years ago, but I was amazed to discover that I could actually feel the movements in the skull, in the hips, in the pelvis, and it was eye-opening for me. So, you know, I was practicing, as you, a more basic form of chiropractic at the time, but once I studied that, I thought, wow, there's more here that really I need to learn about. But I didn't get into the different levels of it at that point. But it's still fascinating to me because I understand that many health issues can be helped through this very subtle correction. And so especially for those people who are maybe uncomfortable getting adjustments in the regular way because they've maybe waited too long in their life and they have a bit of osteoarthritis, still can get a lot of benefit from the craniosacral work.
Definitely can. It's very gentle, and one of the nice things I like about it is people with post-traumatic stress disorder or just after a car accident, I will frequently do craniosacral therapy on them first to try to relax the body. It's not traumatic. I might not want to do a traumatic rotary adjustment right after an accident.
Right.
I certainly don't want to do anything like that on children or infants, but I use cranial work all the time on kids or elderly people that you're not going to be using a lot of force anymore. You've got all kinds of different things you can do with that.
Right. So let's go through some of the things, maybe in your own experience or perhaps what they teach in the course, the types of presentation that people might come to you with, the type of conditions that people often, let's say frequently, can get results with, but also the more bizarre, because we like to hear about the strange things too. But
okay, so most of the time people come in with headaches, migraines, TMJ syndrome, grinding their teeth at night, and we find that helps that very well. Other patients will come in and they'll be having a lot of dental work, and I will say, you know, after you get all your dental work done, make an appointment and let's not only adjust you but check your cranium, because you sit there and your jaw is tight and it's tense.
How about kids with braces? Do they end up with problems as well? Or
yes,
find that?
And that can be an interesting one because our upper palate does have a suture in it. You can't really see it here, sorry. And when you lock the teeth down here, it can cause a lot of problems because now that suture doesn't have its little bit of movement that it's meant to have. So what we will do with braces is work with the kids while they're getting the braces, because you want to get the teeth properly aligned. And just try to keep the movement going as well as possible. And then when they're done and they've got the braces off, then you do maybe a few sessions of craniosacral therapy to get the movement back going again, to restore it back.
I see. So if I'm hearing you right, it sounds like things like when we talk about TMJ, that's the jaw muscles. If they stay tight, maybe that would restrict the movement of the cranial bones if the people are clenching a lot.
Sure.
And that could do that, or people with dental work that's creating stress on those structures. So that can influence the cranial movement and can lead to the symptoms of headaches, probably neck pain and other issues like that.
Yeah, especially the grinding and the clenching. And that's why if there are mouth guards that can keep the teeth separated, I suggest that people get those so that they're not actually holding that tight all night.
How about other issues that may affect, like our vision or hearing or balance? Any of those things commonly associated with craniosacral?
Sure. You know, people with dizziness, vertigo, things like that, I always check them to see, and a lot of times that would be the temporal bones, these big red bones in here, because, of course, our ears and the ear canal are within that. If your temporal bones get out of sync or out of alignment, and that can cause problems with some dizziness, lightheadedness, things like that. Sometimes with Meniere's, I found it's maybe not Meniere's, but it's a cranial problem, and sometimes it actually is, so it sort of depends.
So unless the doctor's familiar with craniosacral movements, they probably wouldn't think to check those kind of things.
No, unfortunately the doctors probably wouldn't think to do that and wouldn't tell you to go get that checked.
So I would say it would make sense if a person has had periodic dizziness, Meniere's disease, as you said, you can get tinnitus, those kind of things, to make sure if you've done the other treatments and they haven't really helped, rather than depending on more and more medications, try to look to craniosacral work to see if that would help.
Yeah, because and the nice thing about craniosacral therapy is it's gentle, and there's usually not any bad side effects. It's not traumatic.
Right.
You know, you're usually going to know within 3 sessions or so whether it's going to help or not.
Right. Any other real interesting cases that you've had? You don't have to mention names, but
yeah,
tell us
I've
about
had
those.
somebody with something called pseudotumor cerebri, which is, they call it a benign intracranial hypertension, and it means you have too much pressure. There's too much production of cerebral spinal fluid. They don't understand why. Sometimes it happens in children, but sometimes it happens in people in their 20s. And they'll often put a shunt in to drain it.
I've seen patients with that shunt,
Which can help, but I have had success in treating somebody with that. When she first came in to see me, her rhythm, you know, I'm supposed to feel, the rhythm is usually 6 to 12 cycles per minute, and it's a kind of gentle out and a gentle in. And I guess the only way I could describe it is it was working. You know, you could tell something was happening, but it was almost frantic. So it was in and out, in and out, and in and out. And it took about 3 sessions to restore the rhythm, but I didn't find a lot of major cranial faults where there were things jammed or real big restrictions, but I found that this rhythm was completely off. So we restored the rhythm, and that started, she already had a shunt in at that point. That made a big difference, brought the headaches down a lot, and really is helping her to continue to function
and live.
Maybe in
hindsight that was causing the buildup of the pressure if the body couldn't circulate it properly.
It could be. You know, I
Wow.
mean, these are the things that we have to say. It's a theory. Craniosacral therapy is wonderful in that come in, we will find what we find, and we will correct what we can with it, and then you see how the body heals itself. And that's the beauty with it, is it's allowing the body to heal itself, and that's really what we're trying to get at with chiropractic and craniosacral therapy.
So, again, I think the concept is probably new to a lot of people, that the head actually moves. It actually expands and contracts. But it does so in a very rhythmic way and in a very specific way, so that a certain physiology can be normal in the body. And if we change that, it's like the things in your watch, you know, the little cogs. If those can't move freely, then your watch isn't going to work properly. So you're helping to find out which cogs are not functioning properly and how you might restore that function through the gentle corrections.
Yeah,
I
exactly.
see. Well, I'm really fascinated to find if there is applications to that. I mean, is there some way that people would know, like a symptom that they might have, that would indicate, you know, this is something that they should be looking for, a person who practices craniosacral work?
You know, one of the other things that we haven't brought up is mental clarity, inability to focus,
Right.
And really attention deficit disorder, ADHD. The Upledger Institute has done a lot of research with autism.
Wow.
And they found that they can really help the kids calm down and focus better. And they have a big program with veterans and post-traumatic stress disorder, helping them, you know, because sometimes anger comes up, and it helps to relieve the tensions in the body so that the person can have more mental clarity and feel better, learn how to deal with their stress better. I've definitely seen people with chronic fatigue syndrome or fibromyalgia. It can be very helpful with those too, because again, a lot of times you can't handle a lot of deep tissue pressure, but you have a lot of tension in the body. And this is great for getting the tension to be relieved so that the person can then relax, their muscles can relax, and they can feel better. So those are the other kind of things I think are really important to tell people about, is that there's so many different problems you could be having that you can relate back to problems within the central nervous system. The central nervous system controls nearly everything in our body, and if it cannot heal itself, fix itself, it's going to come up with a myriad of strange symptoms. And a lot of times I will tell people, we will again identify whatever problems, what restrictions we find. Do you have a suture that's jammed? We'll release those and then watch and see what happens with that.
Fascinating. I know, just to put in context, we're not talking about dealing with muscles. That would be like a massage therapist or a chiropractor who deals with the bones and joints. But this is actually affecting the central nerve system,
Yes.
which then controls and monitors everything that happens to us. So if there's an imbalance, even if it were a musculoskeletal issue like your whiplash injury initially, it's going to affect the central nerve system's ability to perceive itself. So even though a musculoskeletal condition may have corrected itself, there's a central nerve system aspect to that. And it sounds like what you're talking about is that the craniosacral corrections actually affect the nerve system to help then correct whatever else is going on in the body.
Exactly.
Yeah.
Exactly. And I find it really have a great adjunct to the chiropractic, because sometimes I find I'm not going to be able to get this adjustment very well. Things are too tight. So I will do some craniosacral therapy first and then do an adjustment. Sometimes I find I have to do an adjustment in order to get a release in the let's say the sutures of the skull.
Right.
The way our muscles attach to the skull, they attach back here, up on the occiput, in the temporal bone, the SCM, these muscles here attach here. So if they're pulling unevenly on the body, then your little jigsaw puzzle of the skull is going to be torqued.
Yeah.
So sometimes I want to release the muscles, adjust C1, adjust the area to release that tension. Then sometimes that will correct the problem within the cranium, or then I can do a little more cranial work to relieve that. And hopefully that's a little longer lasting type of correction.
I think that's what everybody's looking for, is something that will help be a long-lasting correction, something that will give them not only the tools, but also give them relief. So we want to just finish up and find out if you have some suggestions. I don't know if there's anything that you typically tell people to do at home to help corrections stay in, or to help prevent reoccurrences, like you had mentioned, the jaw problems. Is there anything that the people at home would do for themselves to help with this craniosacral rhythm, other than not hit your head on a cabinet door?
Yeah, you know, there's actually one, the craniosacral rhythm can stop, and we call that a still point.
Right.
And that is when the body does most of its corrections. And it's not like your heartbeat. It doesn't have to go 24/7. It can stop and have these corrections. So one of the little tools I tell people to do to go home is put 2 tennis balls in a sock, tie the sock off tight so the tennis balls are right next to each other, and then you actually lay on them. You put them on the back of your head, not on your neck where you'd think they'd go, but on the back of your head. So they're right about in here. And you can lay on those even 5 minutes. If you can lay on them for 20 minutes, if it's comfortable enough. What that should do is put the body into what we call a still point, because it puts pressure on these sutures and stops the craniosacral rhythm for a brief period of time. So you could lay on these for 5 minutes to 20 minutes, then take them out, and then stay down and lay there for another, take a little nap or whatever.
Kind of like rebooting your computer.
Rebooting your computer, because if you put it into a still point, you're hoping then that the body will then do some self-correcting.
Right. Well, thank you so much for your help and your input. I would love to hear more. We may have to do a second show, so we'll decide. You know, if you want to hear more, let us know. Thank you, Dr. Perry, and thank you for the attention from the audience. We appreciate you.
Thank you. Thank you.